The most proximal joint of the free upper limb is the sternoclavicular joint, also known as articulatio sternoclavicularis. It lies medially in the shoulder girdle and connects the sternum with the clavicle. The other joint of the shoulder girdle is found laterally, the acromioclavicular joint, or in Latin, articulatio acromioclavicularis, which connects the acromion of the scapula with the lateral end of the clavicle. Among the joints of the free upper limb, the shoulder joint is the most proximal. It connects the glenoid cavity of the scapula with the head of the humerus. Although these are the articulating bones, the official name of the joint is articulatio humeri, not scapulohumeral joint, although in the literature the term glenohumeral joint is also used. Further down lies the elbow joint, the articulatio cubiti, which is formed between the distal end of the humerus and the proximal end of the radius and the ulna. The joints of the hand are even more complex and best discussed separately. The most proximal wrist joint is the radiocarpal joint, the articulatio radiocarpalis, located between the distal end of the radius and the proximal row of the carpal bones. Between the two carpal rows lies the intercarpal joint, the articulatio intercarpalis, which allows only limited movements. Between the distal row of the carpal bones and the bases of the metacarpal bones are the carpometacarpal joints, and between the heads of the metacarpal bones and the bases of the phalanges are the metacarpophalangeal joints, also in Latin, the articulatio metacarpophalangealis. Between the phalanges themselves are the interphalangeal joints, which can be divided into proximal and distal.